Hello everyone, I am Dr. Muskan Jain, an assistant professor specializing in orthopedics department of paramedical sciences at RNTU. Today we will be shedding light on a global health concern, peptic ulcer. Peptic ulcer understanding, managing and preventing peptic ulcers are open sores that develop on the inner lining of the stomach, upper small intestine or esophagus. These ulcers occur when the protective lining of the digestive tract is damaged, allowing stomach acid to erode the tissues. Understanding the causes, symptoms and management and prevention strategies for peptic ulcers is crucial for effective treatment and reducing the risk of complications. Definition: peptic ulcers are classified into two main types: gastric ulcers, which develop in the lining of the stomach, and the duodenal ulcers, which form in the upper part of the small intestine, known as duodenum. These ulcers can cause varying degrees of discomfort and pain, with symptoms ranging from mild to severe, often affecting an individual's quality of life. Causes: Helicobacter pylori, also known as H. pylori infection. The primary causes of most peptic ulcer is the presence of H. pylori bacteria. This bacterium weakens the protective mucus layer of the stomach and duodenum, allowing acid to cause irritation and eventually lead to ulcers. Non-steroidal anti-inflammatory drugs, NSAIDs. Prolonged use of NSAIDs such as aspirin and ibuprofen can irritate the stomach lining and increase susceptibility to peptic ulcers by disrupting the protective layer. Lifestyle factors: stress, smoking, excessive alcohol consumption and certain dietary habits can contribute to the development of peptic ulcers, though they are not direct causes. Symptoms of peptic ulcer: the symptoms of peptic ulcers can vary among individuals. Common signs and symptoms include burning or gaining pain. Most individuals experience a persistent pain in the abdomen, particularly between meals or during the night. The pain may temporarily improve after taking antacids. Nausea and vomiting: some people with peptic ulcers may experience nausea and occasional vomiting, especially after eating or taking certain medications. Bloating and discomfort: a feeling of fullness or bloating, often accompanied by bleaching and gas, may be present. Heartburn or indigestion: a burning sensation in the chest, commonly referred to as heartburn, may occur, mimicking symptoms of acid reflux. Diagnosis: peptic ulcer involves a combination of medical history, physical examination, tests such as endoscopy, blood stool or breath test to detect H. pylori infection. Endoscopy allows the doctor to view the ulcer and take tissue samples for further analysis. Complications: complications of peptic ulcer may include internal bleeding, perforation and obstruction in the digestive tract. These complications can be life-threatening and require immediate medical attention. It's important to monitor and treat peptic ulcers to prevent these complications. Management of peptic ulcer: effective management of peptic ulcers involves a combination of medications, lifestyle changes and in some cases surgical interventions. Medications: proton pump inhibitor. These medications reduce stomach acid production, allowing the ulcer to heal. Examples include omeprazole, lansoprazole and esomeprazole. Antibiotics: if H. pylori infections is present, a course of antibiotics is prescribed to eradicate the bacteria and prevent ulcer reoccurrence. Cytoprotective agents: medication like sucrasulfate or bismuth help protect the lining of the stomach and duodenum. Lifestyle changes: dietary modification, avoiding spicy foods, acidic foods, caffeine and alcohol can help reduce irritation to the stomach lining. Smoking cessation: quitting smoking can promote ulcer healing and decrease the risk of complication. Stress management: stress reduction techniques such as meditation, yoga, counseling can aid in managing symptoms. Surgical intervention: in severe cases where ulcers do not respond to medications or in instances of complication like bleeding or perforation, surgical procedures may be necessary to repair the ulcer and address the underlying issues. Prevention of peptic ulcer: preventing peptic ulcer involves minimizing risk factors and adopting healthy lifestyles. Avoiding NSAIDs: if possible, limit the use of NSAIDs or consider alternative medications under medical supervision to reduce the risk of ulcer formation. H. pylori eradication: early detection and treatment of H. pylori infection can prevent the development of ulcers. Testing and treatment may involve antibiotics in combination with acid-suppressing medications. Healthy lifestyle habits, adopting a balanced diet rich in fruits, vegetables, and whole grains while avoiding excessive alcohol and smoking can contribute to a healthy stomach environment and reduce ulcer risk. Stress reduction, engaging in stress relieving activities like exercise, meditation, or hobbies can help lower stress levels, potentially reducing the likelihood of developing peptic ulcers. After successful treatment, it's important to follow up with the healthcare provider for monitoring and to ensure complete recovery. Follow up may involve repeat endoscopy, H. pylori testing, and evaluation of symptoms to confirm healing and prevent reoccurrence. Conclusion: understanding the causes, symptoms, and treatment strategies for peptic ulcer is crucial for effective management and prevention. By addressing H. pylori infection, avoiding NSAIDs, and adopting a healthy lifestyle, individuals can risk of developing ulcers and improve digestive health. Thank you.